Earlier this year, Mayo Clinic unveiled its first ever national health checkup, and the response was overwhelming. Now, during this year's election season, Mayo is back with some attitudes about health care during the election season, as well as some other very important topics. Joining us is Dr. John Wald, Medical Director for the Public Affairs Department at Mayo Clinic. Doctor, welcome to the program.
Terrific to be with you today.
Doctor, why is Mayo Clinic conducting these national health checkups?
Well, we are conducting these national health checkups to really gain the pulse of the American health consumer across all domains of America. We have found through 150 years of delivering health care that the best partners are informed partners. And so we'd like to know what Americans feel about cancer, heart disease, diabetes, so that we can best partner with them to deliver the best health solutions.
Doctor, tell us about what are the health issues that are affecting Americans regarding this presidential race.
Well, I think we found that Americans are concerned about health care moving forward, and that 3/4 of Americans have defined access to health care, access to affordable health care, and access to high-quality affordable health care as determinants in choosing a presidential candidate in this election year.
Were you concerned about individual candidates, or is this an overall outlook?
This is certainly an overall outlook. Mayo Clinic is committed to partnering with all Americans to deliver high-quality, affordable health care, no matter which candidate wins in this year's election.
Doctor, tell us about the concerns Americans have when it comes to diseases such as Alzheimer's or dementia.
Well, mental health is truly on the minds of the American health consumer. And we found that baby boomers, in fact, 60% of them are concerned about diseases like Alzheimer's disease. But it's not just a concern of the baby boomers. Millennials and Generation Xers, in fact, 50% of those individuals are concerned about their brain health as well.
I understand you also looked into sleep habits. What did the survey tell us about that?
Well, in much the same way as we discovered in our first health checkup in the first part of this year, work-life balance continues to be an issue. And even though 3/4 of Americans were able to identify that 7 to 9 hours of sleep was the optimal amount of sleep needed for each individual, only 50% of Americans were able to obtain that 50% of the time. So Americans are continuing to struggle with getting the right amount of sleep.
And I understand the other area that you covered concerned cancer prevention and research. Tell us about that.
Well, cancer continues to be on the minds of all Americans. In fact, it was the #1 health concern of Americans as part of the survey. They stated that brain cancer was the scariest form of cancer for them. In fact, 37% of Americans identified brain cancer as the scariest form of cancer for them.
Doctor, if viewers would like to get more information about the survey and Mayo Clinic, where should they go?
Well, they can certainly go to healthcheckup.mayoclinic.org for information not only on this survey, but for prior surveys that have been conducted. And for all things related to health, wellness, and disease, mayoclinic.org is a terrific place to go.
Dr. John Wald, the Medical Director for Mayo Clinic's Public Affairs Department, with some information on the latest installment of the National Health Checkup. Thanks for spending some time with us.
Terrific to be with you today.